Hey everyone, so this week I'm reflecting on the materials about women and addiction and how these issues affect not only individuals but also entire families. And I want to begin with the reading titled Exploring the Intersection of Violence and Drug Abuse for Women. What stood out to me was how often addiction begins as a way to cope with trauma, often including intimate partner violence and sexual abuse. And the reading does a great job of explaining that many women use substances to numb emotional pain, and that addiction itself can make them more vulnerable to exploitation and coercion. Families, especially children, feel the effects from instability to emotional distress, and showing that addiction impacts not just, it also shows that the addiction impacts not just the individual, but the family unit as a whole. And comparing this to our textbook, which focuses on the biological and behavioral mechanisms of addiction, this reading adds the social and relational dimensions that uniquely affect women. And together, they highlight that addiction is rarely an isolated issue. The theme of gender-specific challenges is reinforced in the video Overcoming Addiction, Why It's Different for Women from the Hazelden Betty Ford Foundation. Okay, so Dr. Christian Smith explains biological factors, making the connection between higher estrogen levels, increasing susceptibility, and women metabolizing alcohol differently, which contributes to the telescoping effect where women develop severe addiction and medical complications faster than men. Environmentally, women are more likely to be introduced to substances by a partner, face childcare responsibilities, and or have limited economic or insurance resources, all of which impact treatment access, basically. And the host, William Moyers, asks excellent questions, making the interview with Dr. Schmidt pretty thorough. Dr. Schmidt references a few studies conducted between male and females and substance use. She gives the example of a study between male and female rats, and she notes that while male rats titrate off the use of substances, female rats increase their use. And she then connects this to the fact that environmentally, women are relational substance users, and she cites a statistic that 50% of female heroin users first time being injected were by their male partners. She made a great point about women being caretakers and how when they have children, it influences their ability to access treatment, and they don't know what to do in regards to childcare. Followed by that, she paraphrases a study on meth usage. Dr. Schmidt says that the reason women use meth is to go to work, take care of their children, clean the house, and they want that extra energy as a component. The host, Bill Moyers, then shifts the subject to make a distinct connection to women who abuse substances and sexual abuse history, to which Dr. Schmidt references a study on female sex workers in Canada, stating 75% of female sex workers that suffered abuse before the age of 18 went on within 6 months to injecting substances, and that PTSD makes them 5 times more likely to use substances than women who haven't had prior traumatic experiences in life. She then clarifies and closes on the science that women do much better when they have peer support networks, longitudinal care with trusted providers, and programs tailored to women's experiences. This shows that treatment alone isn't enough, and that ongoing recovery and management is critical for long-term success. This piece was, to me, a great eye-opener with very valuable information, and a lot of which I didn't even know. In the article, Women's Barriers to Specialty Substance Abuse Treatment, a qualitative exploration of racial and ethnic differences, shows that access is complicated by childcare, stigma, financial limitations, and legal or family concerns, and how these barriers are particularly pronounced for women of color, confirming that structural disparities strongly influence treatment, access, and outcomes. The research article, Trajectories of Alcohol Use and Consequences in College Women with and Without Depressed Mood, examined alcohol-related outcomes among college women with and without depressed mood. The hypothesis was that depressed women would experience consistently worse consequences as a result. And I think while the study did show a greater consequences earlier on, it also found their negative outcomes declined over time more than expected. The partially contradicted, I think it contradicted the hypothesis, and it connects directly to our prior module on mental health, emphasizing the close relationship between depression and substance use and the importance of integrated screening and support. Overall, I thought these readings and the videos have broadened my perspective, and I've learned that addiction in women is shaped by biology, trauma, social relationships, and systemic inequalities, and that effective treatment must account for all of these factors. This confirms and also deepens my empathy, and it's clear that addiction is rarely a personal failing, but often a response to complex, unique circumstances. So in summary, I referenced Exploring the Intersection of Violence and Drug Abuse for Women, the other article, Overcoming Addiction, Why It's Different for Women, Women's Barriers to Specialty Substance Abuse Treatment, and Trajectories of Alcohol Use and Consequences in College Women with and Without Depressed Mood. To wrap this up, I thought each source shaped my understanding to addiction's impact on women and families, treatment considerations, and mental health connections. And hopefully with all this information and technology and science we have and data that we have today, we can do better in the future. Thank you.